Hello again, welcome to part 2 of the video series that summarizes my explanation for what I believe causes chronic fatigue syndrome and fibromyalgia syndrome. Please make sure that you watch part 1 of the series first, where we identify an autonomic nervous system dysfunction as being absolutely central to CFS. Okay, so the question is, why is this ANS dysfunction occurring? What actually controls the ANS? Well, first thing, let's start by recapping and understanding a few things. In particular, the ANS. We want to really understand in a little bit more detail. The chief function of the ANS is to keep your body running, to control your heartbeat, your breathing, digestion, and so on, to ensure that you continue to stay alive. It is often divided into two main subsystems, the sympathetic nervous system and the parasympathetic nervous system. So the ANS is regulated between these two systems to have an appropriate response to stress. This could be all different types of stress, but let's split them into two main categories: psychological stress and physiological stress. Psychological stress is a feeling of strain or pressure, feeling overwhelmed, having anxiety and so on. Physiological stress is more like when you have illness or fever or trauma. It could be surgery, even pain or physical exertion can be physiological stress. Other things like hypoglycemia and suffering temperature extremes are also physiological stress. Now, perhaps you're thinking, I seem to have most of those. And look, in that obviously lies another clue as to why this illness perpetuates. Because when we look at the onset of most CFS sufferers, then leading up to first symptoms, there's usually a large amount of stress. And that is obviously one of the factors that we need to consider. Now, some forms of physiological stress that many CFS sufferers identified onset include having a baby, or maybe even several pregnancies in a row with only small gaps in between. Vaccinations, having a physical injury, having a toxic exposure, having an infection. And of course, the stress is ongoing whilst you're ill, both psychologically and physiologically. So now you're actually in a vicious cycle. Your illness causes stress, which doesn't allow your body to heal, and hence it keeps you ill. When stress is extreme and chronic, a gradual breakdown in the regulation of the ANS can occur. And over time, this can be further exacerbated by the creation of inappropriate stress responses and also an overactive parasympathetic activation. Further, complications occur as a result of this dysfunction. So not only does cortisol change the regulation of the ANS and all the hormones regulated by it, such as the adrenal hormones, the thyroid hormones, adrenaline, noradrenaline, etc., but it also affects the production of serotonin in the brain, as well as acetylcholine and other important neurotransmitters. It is not just simply a matter of how much signaling hormone is present, such as cortisol, but also how the receptors function or degrade over time. And this degradation leads to autonomic dysfunction. This is similar to what happens in type 2 diabetes. It isn't just how much sugar diabetics consume or how much insulin hormone they produce or inject themselves with, but rather how the body reacts to the hormone, which is called insulin resistance. But if the ANS dysfunction is so central, where exactly does it occur? The ANS is controlled in the brainstem, in the medulla oblongata, and also in the pons. There are actually various nuclei in the brainstem that are particularly relevant. Chiefly, these are the A6, also known as the locus coeruleus, the A5 and C1. These are further regulated by the dorsal raphe, which is the main center for the release of serotonin in the forebrain. Now, serotonin is central to mood or depression, as well as the production of melatonin, which is involved in sleep. Also, the median raphe is involved, and there's also axons that project into many other areas of the brain, including the thalamus, the hypothalamus, the basal ganglia, the amygdala, the neocortex, and also the spinal cord. Now, there is a complex interaction between these nuclei. Let me summarize by saying that the locus coeruleus is key in regulating between the neural and the adrenal sympathetic nervous system response. So you remember I said that adrenal function is only a part of the sympathetic nervous system. A lot of the response is actually via the nerve fibers, which is obviously lightning fast. And the locus coeruleus, which normally balances the ANS, actually naturally declines in function as we age. It also matures late in life, in your late teens. I believe that this is not only what explains why CFS is more prominent in people over the age of 40, but also why we see a higher than normal incidence of childhood trauma in CFS sufferers. But here is a key point to realize. Excessive or chronic stress will actually also reduce the function of the locus coeruleus, and the extremely complex feedback loop between cortisol, serotonin, noradrenaline, and other neurotransmitters can lead into a whole spiral of dysfunction. So it's not just the amount of stress present in your system, but the way your body actually responds to this has been changed, leaving you stuck in this vicious cycle. So now we can see why different people get into CFS in different ways. What they have in common is this stress. Now, whilst one person may have suffered a physical assault, another person may have suffered 2 pregnancies in a row that were with little time in between, or someone else may have had a toxic exposure. They may have had a vaccination. They could have had a bad viral infection. There's really a whole range of triggers initially. Okay, now you might be starting to see how the symptoms are created and why people get CFS in so many different ways. But other questions remain, mainly around treatment. Perhaps you can already start to see why some treatments work for one person and not another. But in my third and final video, I will explain the treatment conundrum in a little detail and also outline what I believe are some of the most important elements of a successful recovery from CFS. Thank you for watching. I'll see you in my next video.